Okay, this is a sagittal section showing the left side of the pelvic region. This is the left testis, and going up we have the layers of the spermatic cord. Among them, this is, and we're going up from the testis. This is the vas deferens or ductus deferens, and here it dilates to form the ampulla of the vas deferens. And he said particularly that if the pointer is here, you have to say this is the ampulla of the vas deferens, not just the vas deferens. Here, this is, you can say vas deferens, but this is the ampulla part. And below, of course, this is a seminal vesicle, the left one. And here we can see the ductus is opening into the penile urethra as the ejaculatory duct. Okay? And this is the bladder. This is the apex of the bladder, and this is the anterior aspect. This is the left side. This is the apex of the bladder, and this is the median umbilical ligament, the remnant of the urachus or the allantois. And this is the superior, and you just say median umbilical ligament. This is the superior aspect of the bladder. Okay, this is the base of the bladder behind. And these are the infralateral surfaces. And you can say this is the left infralateral surface of the bladder in this region. You can see the inside is folded, the mucosa is folded except at the region of the trigone. And this is the side of entrance of the left ureter. Okay, the right side has been removed. And this is half of the trigone. Okay, so this is the interureteric ridge or bar. And this is the internal urethral orifice. Okay? And of course, these are the parts of the urethra. This is the prostatic part here. This is the membranous part. And this is the penile part of the urethra. Of course, this is the region of the penis with the corpora cavernosa above and the corpus spongiosum below. And we can also see, they say this is the dorsal vein of the penis, but we didn't take it in our session. And as we said, the ejaculatory duct opens into the prostatic part of the urethra. This is the prostate. We said that it, and this is also the prostate from the lateral aspect. We said that it has 5 lobes. This is the anterior lobe, the median lobe, the posterior lobe, and 2 lateral lobes. So this is a lateral lobe of the prostate, the left one, okay, left lateral lobe. And the rectum, of course, this is the rectum leading into the anal canal. Here we can see that you can imaginally divide it into 3 imaginary parts according to the peritoneal covering. The first part on the anterior aspect and the lateral sides is covered by peritoneum. Here the middle part, mainly only the anterior aspect. And finally, it's devoid of peritoneum, the lowermost part. In the region of the anal canal, although we didn't take it, but we can say this is the external anal sphincter, okay, the muscle surrounding it. Let's not go into the detail of this, I'm not sure about it. But the muscles, there's also, this is the obturator internus here. And this is the levator ani muscle. Of course, we can say this is the puborectalis part because it's surrounding the rectum. And this is the pubococcygeus and ileococcygeus, yes, ileococcygeus. And Dr. Ruti Amashina, coccygeus muscle, or ileococcygeus bablin. And this fat around here is the retropubic fat pad. Aisha? Anything else left? Oh. Okay. One last thing is the uvula vesicae. When the median lobe of the prostate enlarges, there forms an elevation here in elderly men. It's called the uvula vesicae. So maybe, actually it's trivial. If you have a pointer here, you can see just the trigone of the bladder, not a uvula vesicae. Okay. And also, some speculation here. We're not sure. They say that in their practical session, this was the superior epigastric vessel. Yes, they say these are the superior epigastric vessels, and in my opinion, this is the medial umbilical ligament from the umbilical artery. This one, since this is the median one, this could be the medial umbilical ligament. Okay, this is the pubis.